One side effect of chemotherapy that affects almost all patients is aplasia. In this specific phase of chemotherapy, which is also called the aplasia phase, blood cell production in the bone marrow is severely reduced. This is because the cytostatics, that is, the substances children or teenagers receive during therapy, attack all rapidly dividing cells in the body. These include, of course, the cancer cells. That's great. That's exactly what we want. But unfortunately, it also affects blood cells, among others. And the aplasia phase can vary in duration and severity. The medical team will, of course, always keep you informed about where you or your child currently stand in the process. And with that, meaning this phase, come a few behavioral guidelines that you should follow during this particular aplasia phase. To help you better understand what aplasia is like, I've prepared something for you. Yes, namely 3 jars of candy. In the first one, we have white candies which represent the so-called leukocytes. Leukocytes are our white blood cells. There it is. Leukocytes, white blood cells. That's already important to know, the white ones here, so you easily remember it. Medical staff also call them, since they're all a bit lazy with words, leukos. So instead of saying leukocytes, they'll say something like, how are the leukos? So basically like a nickname. And these little guys are actually really lovable, because functional leukocytes, or leukos, they'll fight against bacteria, viruses, and fungi. They're like the body's police force and a very important part of our immune defense. So police, just to help remember it. So leukocytes, or white blood cells by the way, can't be replaced through a blood transfusion like some blood cells. That also means that in some cases a medication may be necessary to help certain white blood cells, like neutrophil granulocytes, regenerate more quickly after chemotherapy. So, especially during the aplasia phase, but also generally throughout the entire chemotherapy phase, the amount of white blood cells is often lower than normal. A technical term that often comes up in this context is immunosuppressed. In plain terms, this means if the white blood cell count drops, so if it's not as high as it should be, then the risk of getting infections increases, meaning inflammation caused by bacteria, viruses, or whatever else. And for this reason, you should absolutely protect yourselves from infections now and of course be extremely alert at the first signs of illness. So let's talk specifically about the protective measures. During chemotherapy, this means, for example, that you or your child can no longer go to school, kindergarten, or any other similar place because the risk of infection there is simply too high. Large crowds are also not a good idea, such as public transportation, supermarkets, or movie theaters. And as a precaution, doctors often also advise staying away from flowers, houseplants, and also pets, because unfortunately they too can be sources of infection. And, of course, only people who are healthy and show no signs of illness should be allowed to visit. And it is important to follow general hygienic rules, but the nurses will explain that to you. In other words, keep some distance, pay attention to hygiene, like regularly and thoroughly washing your hands. And, if in doubt, wear a mask in everyday situations when it gets crowded or when keeping distance isn't possible. That also includes when you come to the hospital for an examination. Another tip the treatment team often gives is to pay special attention to your diet and kitchen hygiene right now. So for example, wash fruits and vegetables thoroughly, avoid eating raw eggs so that you or your child don't get sick from them. And don't neglect skin and dental care either, because that also actually helps with protection. But what happens if your child or you do end up get sick during this time anyway? And how can you even tell at home? So basically, it's important to watch out for fever, cough, and any kind of inflammation. At the ward, they usually say that if the temperature reaches 38 degrees, you should contact the hospital. But also other signs. Yes, even the slightest signs of infection can be important and a good reason to quickly discuss it with your doctor and, if necessary, get treatment. That could also be just a burning sensation when urinating, a cold sore, an inflamed nail, or irritated skin. For anything that's different or newly appears, please make a call. Alright, the best thing is to discuss with your treatment team to understand when your child or you as a teenager need to be especially careful. And as mentioned, if in doubt, it's better to call the clinic one time too many than too few. So that was the jar with the white blood cells. Let's continue with the next jar. As you can see, there are red candies inside, which represent our red blood cells. These are also called erythrocytes. And of course, there's an abbreviation for that too, eryth. So, when talking about erythrocytes, doctors and nurses either refer to them as eryth or often talk about HB. That's the abbreviation for the red blood pigment hemoglobin, and it's found inside the ears. Hemoglobin has a very, very, very important job in the body. It's a protein responsible for making sure that the oxygen you breathe in with the air is actually transported throughout the entire body. To the individual organs, the brain, and so on and so forth, yes. So you can imagine hemoglobin like a taxi cab constantly driving through the entire body, delivering plenty of oxygen to everyone, right? And what happens if there are no taxis or not enough of them? Exactly, too little oxygen gets delivered. Then you might feel tired, right? And sluggish, yeah, get a headache, or maybe you might even feel a bit dizzy. If you have a low hemoglobin level, doctors often refer to that as anemia. If the hemoglobin is too low, sometimes a blood transfusion is necessary so that more red blood cells and therefore more hemoglobin or taxicabs are available again. Doctors also often refer to these as RBC units. That's another abbreviation you may already have heard of. RBC stands for red blood cell count. No one actually says that. So EC is the erythrocyte concentration. All right, and with that, we come to our last jar of candy. As you can see, they look a little different. Kind of like little discs, right? Those could be platelets. Good choice of candy anyway. So these little discs, I chose them for a good reason, because these chocolate lentils actually represent the thrombocytes. So thrombocytes are our blood platelets. What do people like to call them? Come on, basically thrombos, yeah? Just drop the sites at the end. So thrombos now. And the thrombos are also very important for us, right? For example, when we get injured or start bleeding. Here comes the ambulance. There it is already. Should I park it this way? This way? No, let's park it this way for now. There. So now the little rescue workers make sure that the bleeding can be stopped. If the number of thrombocytes decreases as a result of aplasia, then the risk of bleeding increases. And that means spontaneous bleeding can even occur. That could be, for example, an increase in bruising, even though you haven't bumped into anything. Nosebleeds or bleeding gums. Or so-called petechiae can appear. These are small pinhead-sized red spots on the skin. In theory, internal bleeding can also occur, due to an injury when children play too rough. So you should pay very close attention to any bleeding, whether small or somewhat larger, and always discuss it promptly with your doctors, either by phone or in person. Okay? But in general, you should also clarify what your child or you as a teenager are actually allowed to do at the moment. So whether it's okay to run around in the garden, whether it's okay to play football or ride a bike and so on, or whether you say, better not right now. So physical activity is generally always good, but it shouldn't get too wild in this phase. And that means that anything where you could easily get hurt or injured should be avoided, while the platelet count is low. By the way, it's possible to increase the platelet count through a transfusion, that is, with a platelet concentrate. That's not a red blood cell concentrate, so not an RBC unit, but that is a platelet concentrate. If that's necessary, your treatment team will of course advise you accordingly. So now let us briefly summarize again. We generally speak of aplasia when blood cells are only produced to a limited extent. So when there are fewer blood cells, and this affects the white blood cells, red blood cells, and platelets. The severity can vary. Basically, during chemotherapy, and especially in a phase of aplasia, there are a few things you need to pay attention to. Protect against infections, yes, and if one does occur, no matter how small, be sure to talk to the medical staff. Watch out for signs like fatigue and dizziness, and of course talk to the treatment team about those as well. It may also happen that a blood transfusion is necessary, and children and teenagers have to be more careful with injuries, okay? Because the risk of bleeding can be increased during aplasia. So that was quite a lot of information, right? And I think I've earned myself a little candy for now. I'll take one of these here. What kind of tasty Luco is this? Mint.